I tend to get going talking, so I'm going to time myself here. So I was asked to speak on behalf of MOSH, and actually I work 2 positions at the North End Community Health Centre and with MOSH, and they go together very nicely. And so a quick blurb about MOSH. We stand for Mobile Outreach Street Health. There's 3 phenomenal nurses, Patty Melanson, Monica Flynn, Rick Swain, and we have an OT therapist, occupational therapist, Becky Marvel, and they're just the most outstanding humans ever. So I'm totally lucky to work with that team. I'm working more on a casual fill-in basis. I allow them to go for vacations and have sick time and go to appointments. And in turn, they let me work with them. So MOSH was developed by Patty Melanson, and it kind of tried to address the silos that Dolores spoke of. So it is very much kind of going to the client instead of them having to come to service. In relation to Hep C and HIV, we do on-site testing, education about both, and we collaborate with public health. So if public health has a new diagnosis of Hep C or HIV, can't get a hold of the person because the phone's been turned off, or they've gone to corrections, or they're staying at a new house, we usually, with a lot of help from Direction 180 and Mainline, can kind of have our finger on the pulse of where folks are and get a hold of that person to do teaching, the actual diagnosis. And another piece about MOSH is that its main focus is about relationship building. I'm not sure when they started if that was going to be a big piece, but I think that's mostly what we do. We end up being written down as next of kin on many, many, many people. And so with our relationship, it's often nicer. You don't want to hear that you have HIV or Hep C in a merge or from this funny lady on the phone from public health. So often Emerge or Public Health will call us, and because we know that person, we can go to a place where we know they're comfy, sometimes in the van, sometimes in their house, or at Sobeys parking lot, anywhere, to let them know about that diagnosis, and then set up kind of a future about how we're going to treat that and deal with that, and who needs to know, and how can we get support, yada yada, and going on. So MOSH collaborates really well with we've kind of worked our way into the tertiary care centers. So ID, Infectious Disease Clinic, who treats HIV and Hep C. They're often calling us to find people, or we've helped out with making sure people attend appointments, whether that means we have to go and like grab them off the street and give them a bus ticket or any sort, or drive them to the appointment, sit in on the appointments with folks. We also work with the liver clinic at the hospital, and emergency detox addiction services. It's been a really nice way for them to know that there's someone on the street that can go grab a neck and actually have contact with someone, because it's really hard. So that's kind of my MOSH role, and that program is totally phenomenal. The North End Community Health Centre had some drive and was gracious enough to have foresight in seeing that hepatitis C was not being dealt with in Halifax or Atlantic Canada that much. And so they set aside some money in their very, very dwindling budget to have a treatment and support program at the North End Community Health Centre. So what that means is they asked me to develop a program and said, we want to help out with Hep C, go. So what I've kind of learned over the last 2 years is that we want to treat Hep C, we want to educate folks about Hep C, and we want to support people who are either living with Hep C and will never get treatment, or folks who have Hep C and want to get treatment or are able to. So the North End Clinic has been very gracious with funding and time. Patty and the MOSH team have been unbelievable in support and time allotment. We don't have any extra money. There's no money coming from anyone, so we're trying to use resources in kind and build upon resources that are already in the community. And with that being said, we've kind of started to have conversations with Mainline, Direction 180, Hep C Nova Scotia, and starting to get things going there. As Cindy mentioned, Direction 180 was the first of its kind in Atlantic Canada, I think, to try to start treating hepatitis C in the community. And what that means is hepatitis C, usually you have to go to the hospital, you have to have a booked appointment, you have to then go to the appointment and get in the waiting room, then you have to behave while you're in the waiting room, then you have to behave when you get in with the nurse and then the doctor. You have to listen to what they say and not use swear words. You have to do a lot of things, and it's really, really, really difficult, even for someone who is, very stable and highly educated. So you can imagine when you're having mental health or addiction issues, it's even harder and mostly impossible for some of these folks. So having a relationship with someone in the community, B, they can kind of come and go. We can have a fight one day and they can come back the next day or the next hour. You can call me all kinds of names and see me the next day. I don't encourage it, but I've heard it all, and I actually give points for the most creative cuss words that come at me. I won't go there, but it's really good. Sorry, I'm trying to get a little bit. So I have 8 hours a week to start and run this program, which, as you can imagine, is not much for all of HRM. But it is starting to happen. I work with an absolutely phenomenal physician in the community, Dr. John Fraser, and he has been kind of brave and bold enough to say, yeah, okay, I'll treat people in the community. It hasn't been widely accepted from hepatologists to have community physicians treat in the past. Hepatologists have worked very hard for where they are, and they've spent years, and they have this title, and so it has been a bit threatening to have family physicians do it. However, now they're recognizing with this hepatitis C was more of a transfusion-based disease, spread through transfusion. Now we're moving into an era where most of those people are treated or, God rest them, have deceased, and now we have more of a IV drug-using, tattoo, transfusion-based population, which we all know. So this means that the climate must change in how we deal with those folks. And so I think that hepatologists are really understanding that finally, and they don't like to deal with the cuss words and all of the things that go along with it, so they're a little bit more free. Dr. Fraser has said, yeah, okay, I'll learn. He treated a few people at Direction 180 when they had funding, and unfortunately that money was taken or reallocated because of the high need for methadone. So now we're retrying, and there has been some really good success. So we're working in partnership with the liver clinic, and Carla and Jerry, the nurse practitioners, Dr. Peltecki and Dr. Laria, you probably recognize those names, have been so gracious in just dumping their information that they've gained over 10 years on me. And so here we go, giddy up. I've treated 2 people so far that we've kind of started. Unfortunately, one person had a really bad side effect with retinopathy, so we had to stop because being blind is worse than living with Hep C. And the second fella came into $50,000 during treatment, and you can imagine what that did. Yeah, he had a bit of a party and took off. So we'll continue. I'm about to start 4 or 5 more people this month, I hope. And so that's the treatment side. However, not everyone can be treated or wants to be treated for Hep C, so there's all these folks that are living with Hep C that aren't ever going to be treated or aren't at the place where they want to even think about that. So I believe we really need to make a strong push for support and education in the community. So we're kind of in cahoots with Hep Nova Scotia, trying to start that, and that's why I pose these funny questions, and it sounds like a lot of you have had incredible experiences, and I'm coming after you. So I recognize the faces who said those good words, and I'm hoping that we can start building more of a network of the resources, because as we know, we're not getting my timer's done, not getting new money or new funding, so we need to use what we have. And that's about it. Yeah, that's all I have. So if anyone has questions or anything, because of the nature of being able to kind of bribe people with needing blood work or needing prescriptions, or sometimes I can use that as a way to pull people in. And so if you're ever looking for someone or something like that, sometimes we can work some magic there. My email is j.atkinson@northendcommunityhealthcenter.com, and I'm always happy to hear stories and lend a hand in any way possible, so feel free to get in touch. Thank you.